Unfortunately, stress fractures are very real in young athletes. A stress fracture is a tiny fracture to an area of the vertebra in the low back, typically, in our lumbar spine. They're typically caused from high impact or high velocity type movements, hyperextension, someone gets back into an extension, or repetitive type activities. Many times we see stress fractures in young athletes such as gymnasts, cheerleaders, where a lot of tumbling, hyperextension is involved. They're also very difficult to diagnose. The patients will typically complain of localized low back pain or just pain to the low back, which is made worse with bending backwards. Typically, it's not picked up on x-ray. So obviously we want to do an x-ray just to determine what may be going on in the low back. It's such a small, very fracture to an area of the vertebra called the pars. MRI and bone scans may be an option from there to determine. Many things can cause these, but for the most part, conservative treatment is a good option for these types of cases. First off, we want to rest. We obviously want to suppress or start to shut down their activity. If they're an athlete, we want to maybe limit their activity. NSAIDs, some form of anti-inflammatories, are always a good option. Therapy is a fantastic option. Working on stabilization of the core around the lumbar spine, maybe flexibility above and below the injury site. And then in worst case scenarios, bracing is also an option for as well. Typically, stress fractures heal with no residual recurring effect, but stress fractures are very real. So if you have an athlete that's complaining of localized low back associated with acute injury, might not be a bad idea to get them checked out.